everyone, welcome to my channel. This channel is going to be about something called P.O.T.S, or Postural Orthostatic Tachycardia Syndrome. Now, that name is kind of long and can be kind of hard to say, so I'm going to break it down. Postural, laying down, to sitting, to standing. Orthostatic means standing, so some people do just leave out the orthostatic part due to the fact that postural and orthostatic pretty much mean the same thing. Then tachycardia just means very high heart rate. Then syndrome. Syndrome means the fact that there is a long list of symptoms and they vary between patient to patient. So no two P.O.T.S patients are the same. Now, this is not a cardiac condition. It is actually a malfunction of the autonomic nervous system. The autonomic nervous system controls everything you don't consciously think about to control. Then, in order to get diagnosed with this, you have to get something called a tilt table test ran. What they're going to do is they're going to ask you to lay down on a table for at least 10 minutes as they monitor your heart rate and blood pressure. That way they can get your resting heart rate and blood pressure. Then they're going to either have the table tilt you up or ask you to stand up. And they'll have you standing there for at least 10 minutes, monitoring your heart rate and blood pressure. After this time, they will come in and give you your results. Now what they're looking for is, if you're a teenager, you have to have an increase of 40 beats per minute and symptoms as soon as you stand up. Then, if you're an adult, you have to have an increase of 30 beats per minute and symptoms upon the standing position. Now, this happens because when a P.O.T.S patient stands up, instead of the blood vessels constricting to send the blood back up to the heart and other organs, it just kind of pools in our feet and lower extremities. And when somebody who does not have P.O.T.S stands up, their blood vessels will constrict and send that blood back up. Then, a lot of times we don't absorb water properly, so in order for your body to make blood, it has to have enough water in it and enough salt. So, since we do not absorb the water properly, we have to drink a ton of water and a lot of times have a very high salt diet. And that helps with keeping up that blood volume to help with that tachycardia. That is what P.O.T.S is, and thank you for watching. Bye!